Hello and welcome to YHTV's nominated show, The Magical Medical Tour. This is episode 96. Thank you so much for joining us today. I'm Christina Suzuma, and with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Dr. Woolman.
Hello, Christina.
This is a fun show, isn't it? It will be. We're testing something new. Where I'm on location at the same time.
Yeah, we're both away from Segovia.
Yes. Bye, Segovia. Hi, Segovia.
Can he handle it?
I don't know if he can. We'll see. We'll see how he does.
We'll keep checking in throughout the show today to see if he's handling it.
That sounds super great. So are we doing... Oh, sorry.
Oh, no, that's all right. Are we doing
one of our little specials with you today?
Yes, we're going inside the doctor's bag for another public service episode.
Sounds great. Always love them.
Yeah, this is my opportunity to do sometimes current events and sometimes just to give people more and more advice on how to take care of themselves. So that's my plan for today. But before that, I want to say greetings, everyone, and welcome to Magical Medical Tour. I'm Dr. Glenn Woolman, and I will be your medical guide today, along with Christina, as we travel through another quadrant of the healthcare galaxy, searching for optimal health. I hope you're all finding it by now. By 96 episodes, you should have some version of optimal health by now. What do you think, Christina?
I sure hope so.
Yeah. Otherwise, what's the point here?
I agree. It's really fascinating though, because there's so much. And I even find myself having to go back to previous episodes to go, what was that? What was it that we talked about that we need to implement?
Right. Well, it's good. That's one of the ideas and pillars of our show, is to have enough episodes where people can use this as a 21st century visual, virtual guidebook. To go back and learn things. And as we keep adding episodes, there'll be more and more things to learn. And of course, in medicine, one of the great things about medicine is it's a constant frontier where we're always pushing the envelope and learning new things and changing old theories and ideas for new things. And so keeping up is very important. That's why it's important that everyone watches every week and continues to watch it throughout the week. Don't you agree?
Oh, absolutely. And if you can't watch it, just listen.
Yeah, just listen to it. Right.
Yeah, I agree. Absolutely.
So we're going inside the doctor's bag today. And I want to talk about two major topics. One is a current topic that's happening in California right now and parts of Canada where there's a measles outbreak. So I thought I would talk about that. And then the second part will be about what to do when and if you get into an accident. And I'm not necessarily talking about a big accident, sometimes small little accidents that we need to figure out the right things to do. Of course, most people probably know certain things, but I just want to put it from my perspective.
That's great.
Yeah,
especially for us parents, We're running into accidents all the time.
Yeah, I think, that's part of life. That's why I always talk about preparatory medicine along with preventive medicine. We have to prepare for accidents and injuries and illness, things like that. So let's start with this measles outbreak that's going on both in California right now, specifically and mainly Southern California, although it's happening around different parts of California, and also part of British Columbia is having a little outbreak. So I thought it'd be interesting to discuss that with people. And I want to start by giving a definition of epidemiology. And epidemiology is a special branch of medicine. And this branch of medicine deals with the incidence, the distribution, and the possible control of disease and other factors relating to health. So when you hear about things like the CDC talks about an epidemic in this country or in that country or a possible flu season. It's the epidemiologists that are out there looking and figuring out all the numbers and how to track a disease or a problem. We don't just talk about disease anymore. There are many things that we talk about in epidemiology. So with that in mind, there are a few words that I think would be a good idea to learn. One is, the first word is called endemic. E-N as in Nancy, D-E-M as in mother, I-C. And this refers to a constant presence or a usual prevalence of some kind of disease. So, you know, there may be endemic flus or endemic diseases that are basic but small levels in an area, local area, or a country, or something like that. We always say that, for example, malaria might be endemic in certain parts of Africa. It means it's always there, but it's at a low level. Then we talk about epidemic, which refers to a basic increase and often it's sudden, number of cases of a disease above what is normally experienced in that population or area. And sometimes we use the word outbreak, just like an epidemic, but usually an outbreak we talk about when it's localized to a certain geographic area, but you can sometimes use them intermittently. For me, an outbreak is a little less than epidemic. And then there's pandemic, which is something that is prevalent around a whole country or the world. So when I mentioned earlier, you know, sometimes we can get the influenza virus, which we've spoken about in other shows, and other viruses. We talk about viruses. In episode 65, we talked about going viral. And in our first episode, I think with Stephen Jose, we talked about viruses with predators. And with Mary Louise Scully, we talked about viruses that you can get when you're traveling. But sometimes we also talk about other things with pandemic. For instance, now diabetes and obesity, childhood obesity, we start referring to in terms of epidemics and pandemics. And it's not just about a virus or a disease anymore like that, but there are many things. So I want to talk about measles for a little while. And I'd like to give a little bit of a medical history about measles. Sometimes it's fun to have just a little extra knowledge. We always usually just focus on the disease itself, but it's fun from a historical point of view. We have written evidence from a 9th century Middle Eastern physician who described what appears to be the difference between measles and smallpox. So that was about the first evidence that we had that it existed back then. And then yeah, back in the 9th century. That's pretty cool.
Wow, it's amazing.
Yeah. In 1757, a Scottish physician named Francis Home, hope I'm pronouncing that correctly, discovered that the cause of measles was by an infectious agent, and it was in the blood. And then in 1954, the virus that actually causes the measles was isolated in Boston, Massachusetts, by two people, John Enders and Thomas Peebles. And now we know a lot more about measles. And just to let people know, we've heard of, I think, two different types of measles. We've heard of measles, and then maybe you've heard of the word German measles. Have you ever heard that before?
Yeah, absolutely. We used to hear that a lot growing up here in Canada.
Yeah. So there are actually two different viruses. They're a little bit similar, but the measles that we're having the outbreak with it's a rubeola virus. And the German measles is a rubella virus. And you've heard the word rubella. Most parents have heard that word when they have to hear about vaccinations for their kids, where they have that vaccination, the MMR vaccinations, which is measles, mumps, and rubella. So they call the measles that they talk about is the rubeola virus, and that's the breakout that's going on today. The measles vaccine was developed in 1963, and the MMR vaccine was developed in 1971. So, you hear those terms, 71 sounds like it's close, but it's actually about 40 years ago. And that becomes interesting for me to think that time moves on that quickly. Before these vaccines, there used to be in the United States around 500,000 cases of measles per year. And out of those 500,000, there were sometimes up to 500 deaths from measles. There were complications. In that time, 50,000 people essentially were hospitalized. Around 7,000 people would have some kind of a seizure. About 1,000 people suffered permanent brain damage, including deafness, sometimes blindness. And but that's going down now. Since the advent of the vaccines, we've only had about 108 confirmed cases of measles in the United States so far this year in 2014. Although, because of this outbreak, we've had about somewhere close to 60 cases in California right now. But we need to understand that measles is also very prevalent in other countries. The Philippines, Turkey, Vietnam, Italy, Germany, the Netherlands, Africa, lots of other parts of Europe. So these outbreaks happen all over the world, and we take it for granted here because of the vaccinations. We've taken care of most of the cases of measles, but because of travel now, and people traveling from here and catching something there, or people coming from other places and bringing it here, there's more of a prevalence again. And what we're finding is that the prevalence starts, and usually the majority of people that end up getting these measles in the outbreaks here after it's caught by or transmitted by someone else, it's usually people that have not been vaccinated, either completely vaccinated or have chosen not to be vaccinated. So what do we need to know? The first thing I think to talk about is what's the cause. And we know that it's a virus. I talked about that already. It's that rubeola virus. And it's usually considered a respiratory disease. And it's also a human disease. They haven't found it really in any animals. So it normally starts out and is transmitted and spread through an upper respiratory cough or sneeze or something on the mouth. And this virus can live outside of the body for about 2 hours or so, and that's variable. So in other words, if somebody goes into a bathroom, coughs into a towel, and then an hour later you go in and use that same towel, and that virus is on the towel, and you have not been vaccinated, there's a good possibility you're going to get the measles. I do want to mention, before we go forward, that rubella virus that we talked about, which is the German measles. It's much more mild. It's only about a 3-day measles, so it's not too bad. So we know how
I had always thought it was opposite way around.
No, the rubella virus, the German measles, is much less virulent and doesn't cause
the symptoms are the same?
They're about the same. You don't get as high a fever. And I'm going to go over the symptoms in a couple of seconds. Everything is much more mild, and it doesn't last quite as long. Usually they also call them, instead of the German measles, sometimes they call them the 3-day measles. So, and that's about how long it lasts. So it's important to know how it spreads. It's spread through contact and coughing and air droplets. And it usually, the virus settles in the cells. We always talk about cells. It settles in the back of the throat, in those cells, in the nasopharyngeal area, and in the upper respiratory part of the body, the lungs. It can get into the lungs. And so a person can be exposed, and then they can go for about somewhere between 4 and 10 days, even up to 2 or 3 weeks. But usually it's between 4 to 10 days, depending on the virulence or the strength of the virus, before they start getting symptoms of it. And the first symptom is usually a high fever, not feeling well. And the fever can go actually up to around 105, especially in kids. And then you start feeling malaise. Then the next things that happen are a runny nose, a cough. And if someone is wise enough to look inside the mouth, on the inside of the cheeks of a child or an adult, you'll see these white spots that occur. They're called Koplik. Starts with a K, Koplik spots, and not everybody always sees them. And then after about 4 to 5 days with the fever, you start to develop this rash, which is itchy and scaling and a little red, sometimes flat, but it can have a little raised part in it. Usually starts around the back of the head, the hairline, behind the ears. That's where we always used to look for it first. Then it went to the face. Then it would eventually make its way to the body, down to the hands and feet, and last for up to 4 to 5 days. Sometimes it could be up to a week. Now, the important things to realize is that when is a person contagious? And that's the thing that we need to talk about, because the whole idea of this is how it spreads and how it's transmitted, and then it goes from one person to an outbreak and then an epidemic. And you can be contagious from the moment you get exposed. Within about the first 4 days, even before the appearance of the rash, you are contagious. So even a day or two before you start getting the fever, you're contagious. So the fever, high fever, runny eyes, pink eyes. The eyes can actually get red and inflamed and infected, and this is one of the side effects that could happen, or complications, which we worry about. Then the rash happens, and we go from there. And eventually, the rash goes away, everything goes away, and if you didn't have complications from this, and you were not a person who was immunized or vaccinated, at that point, you will probably have an immunity for the rest of your life to measles, unless, of course, the measles virus changes. It's highly contagious. That's one of the important things to know. And when we start talking about the complications, that's what makes it most serious, the complications that you can have. So the complications, aside from just the fever and feeling tired, you can get bloated, a little bit nauseated, you get the runny nose, the runny eyes, but you can develop what we call complications, are ear infections, things like pneumonia, a lung infection, and encephalitis, which is a inflammation of the brain, and it's a swelling of the brain. And about 1 or 2% out of 1,000 people that get a serious complication can die from it. So it's not just a cold. It can actually cause death in people, and the death usually comes from a brain problem or a severe infection. And most of the time, it's because a person is malnourished or their nutrition isn't good. So it's very important, if a family decides not to vaccinate their child or to be vaccinated themselves, then it's very important to keep up good nutrition, exercise, and get plenty of sleep and rest and fluids, and try and stay as far away from anyone that may potentially have the measles as you can. Of course, it's almost impossible, but that's the important thing to know. The measles virus still kills close to 170,000 people around the world each year.
Wow.
Yeah, we think of it here in this country, that's our exposure to how medicine is and how health is. But there are many places around the world where nutrition isn't good. There aren't clinics, there aren't vaccines. And people, once that virus sets in and becomes endemic, it can wreak havoc. It's also very important for pregnant women to avoid anyone with the measles if you can. So we talked about how it goes about and what it's caused by and some of the complications and things like that. Everybody is at risk if you're unvaccinated. Mainly, again, usually we see with most viruses, it's very young children and older adults. Also, as I said, pregnant women.
So, for example, as a parent who might have a child that contracts the measles,
right?
And it's so contagious,
right?
And if we haven't had it in our childhood, which means that we haven't built an immunity or we haven't been vaccinated,
right?
What is the best way to care for that child?
Good question. So the treatment, first of all, as I said before, any treatment is the preparatory medicine by making sure the child has nutrition and is basically healthy. The second part is, and here's the real interesting thing, other than the vaccination, there's no specific antiviral treatment. So there is no treatment. But there are some things that can be done. If you're thinking right now, say for example, you're in a place where there might be an outbreak and you have your child and neither you nor your child have ever been vaccinated for measles. So the idea is to first stay away. If for some reason somebody comes over to visit and a day later you hear that that child has come down with the measles, what are the things that you can do? Well, the first thing is to, again, make sure the child is hydrated and is quiet and resting and stays away from everyone else. They need to be isolated. Do not bring them to a clinic. Do not bring them to a hospital. Do not bring them to an emergency department. Best thing to do is either call your private doctor or call a health advisory team, the CDC or something. Wherever you are, there should be a way to find a hotline, and you can talk to someone. They may want to, for the purposes of epidemiology, to actually diagnose this. So they may want you to go to a lab where blood tests would be drawn and throat swabs or nasal swabs would be taken for the actual documentation to prove that it is the measles. But don't go out once you think the possibility exists. Now, there are a few things that you can do. We did talk about hydration and making sure that is very important, because some of the things that can happen are vomiting and diarrhea. And if you lose your electrolytes, then you will certainly go into major complications. So hydration is very important. But if a family decides that their child has been exposed and that they know that they've never had vaccination and that once their child gets it, they're probably going to get it also, you can actually get the vaccine if you choose to do that. The original vaccine is supposed to be given sometime after 6 months, usually around a year. Most parents know this better than I do. And then originally when it came out, it was one vaccine, but they found that some people were still getting it. The immunization qualities within the first vaccine weren't strong enough, so they now recommend a booster, usually somewhere between 4 and 6 years of age, when a child is just about to go to school. I know when I was growing up, we didn't have the vaccine, so when somebody got the measles, all of the parents sent their kids over to that house to get the measles, so that it would essentially give immunization later on. But if a child does get exposed, or if an adult does get exposed, you can actually administer the MMR, which is measles, mumps, and rubella vaccine, within 72 hours after exposure. And if it's been after 6 days of exposure and starting to get symptoms, there's another vaccine, an immune globulin vaccine that can be given. And these won't necessarily prevent it, but they will most likely make it a milder case and less chance for complications. Every once in a while, antibiotics are necessary. if you get a pneumonia or you get a different type of an infection. So antibiotics may be necessary for secondary bacterial infection. But remember, those of you that have listened to our shows before, antibiotics do not work on viruses, and this is a virus. So if you have antibiotics lying around your house from a prior episode of an infection where you didn't take the appropriate amount, don't take the antibiotics. That's important. And one other thing that to talk about with that is, especially we see this in other countries, underdeveloped countries, where it's suggested that a child that comes down with this or an adult that comes down with this get vitamin A supplements, at least 2 doses, 24 hours apart. This has the ability to prevent eye problems and even potentially preventing blindness. And that's very important. So it's a very dangerous disease. It's highly contagious, and it's very rare, but it can be fatal. And I think that that would be all that I want to say about this right now, unless you have some things that you want to talk about, and we can go over that a little bit.
I think I'm coming back. I don't know where to stay up here in Canada or go back down to the
well, now
Southern California.
Well, let's play a little game for a moment here. Let's say that let's hypothetically say that you've never been vaccinated, nor has your child, and we know there's an epidemic or a breakout up there. And let's say you get exposed, and you know that you've been exposed to it. The next process would be, are you going to get on a plane and choose to expose everyone else on that plane, depending on where they go? They may go, from one place to another and then take another plane, and then there's more exposure. Or to be part of at least the human herd immunization concept. Most of the time when we talk about vaccinations, the more people that get vaccinated, the less opportunity there is for something like measles as a virus to be transmitted to other people. I think I've said this already, but most of the people that get the measles are usually under-vaccinated or unvaccinated. So the more people that get vaccinated, we become part of a herd, and we make the decision to say, we don't want anyone else in the herd to get sick, so we're going to be part of that. So if you choose not to be vaccinated, then you still have some herd mentality that needs to be thought about. And if you get exposed, then the decision should be not to get on the plane, and that should be for almost up to 3 weeks.
Wow.
Yeah, and if you do, one of the other things to do especially for a child, but also for an adult, which I hadn't mentioned, is because we talked about how it's transmitted through air droplets with a cough or voice or a sneeze or something, put a mask on the child or put a mask on yourself if you're out in public. And if you don't have a mask, if you can't get a surgical mask, and if you can't get even a more appropriate mask, which the CDC and public health recommend for more specific types of respiratory problems, then at least put a blanket or a handkerchief or something over the child, especially when they're around other children. So that's the first thing. So I would say, that if somebody does come down with it, the most important thing, aside from making sure that they remain healthy, is to make sure that other people remain healthy by not exposing them and transmitting the disease to more people with more of an outbreak.
Oh, makes sense.
Yeah.
Okay, so I'll see you all in 3 weeks. I just keep doing the shows from here. It's working.
That's very good. Yeah, I wasn't sure if you wanted to mention that you were in Canada, but basically it seems like you're trying to go to all the places where measles occur. You're in California.
Been there, done that already.
Yeah, had the measles. Oh, I think there's some in part of Africa now. I think I'll go there next. That'll be fun.
Okay. And
Yeah.
I'll just report back on the next magical medical tour.
Yeah, or you can come down
It'll be
with
the definite tour.
Yeah, but no, that's true. And you can try and find some other really cool viruses and bacteria and parasites, and we could really make this a tour. And
Complete diagnosis online. I love it.
This is Christina Susama coming from New Guinea with Kuru. Kuru is an interesting disease that's transmitted by cannibalism, and it's usually it's found in the brains of people, and usually it's women, because the women are the ones that practice the cannibalism more. But we won't talk about Kuru now. We'll stay with measles right now. So that was just a tease for another show.
I love it.
Yeah, coming events, future attractions. So what do you think right now? What's your thoughts on this, and what do you want to know that I haven't talked about yet?
Well, I think you've covered it quite extensively, actually, and I mean, it definitely was a concern for me because of the breakouts here up in Canada, as well as in Southern California, which is exactly where we live. They were saying that the numbers of the breakouts has been the highest since for a very long time, and of course, as most of our audience may know if they've been following the show, my child is not immunized. So, we boosted all his immune supplements and,
Right.
between the acidophilus and all the viral attack drops and things like that. So it's been very interesting because they have it all, confined now here in British Columbia. That's what they think. That's what they say. So that's really good to hear. And we haven't heard of any of the outbreaks anywhere that we are right now. So that's also very helpful.
Good. You're using the epidemiological terms. Thank you.
I am.
You used outbreak.
Oh, I did? Okay.
Memory loss is one of the first signs.
Yeah. I think if anyone's going to get it, it's me.
At some point, I think it's going to be important. We've skirted around the issue for many episodes, talking about vaccinations, but it might be interesting to have a panel show with the pluses and the minuses about the vaccines. The World Health Organization is trying to eradicate measles, and that requires getting vaccinations around the world, double doses of the vaccinations. And I think they've given over 2 billion vaccinations, up till now, and maybe more. Many of the people worry about the complications of the vaccinations, and I think that's most of the reasons that people choose not to do that. Was that your choice because of worrying about complications, or did you have a different reason?
That was I have to say a percentage of it, but it wasn't the highest percentage.
Mm-hmm.
I also believe that our bodies can tolerate a lot. Throughout the years. What I loved that you said was people who choose to not immunize, they need to make sure that they are keeping their child healthy, physically healthy, healthy nutrition, and of course we usually need the added supplements, etc. Good vitamins. Like for example, when we see the average child at school, they're usually lethargic when they come in. They have very high, sugar diets, high fat diets, whereas we live very clean. And I've had so many of the teachers just say, "We don't know how you do it, but your child has such high energy in the class."
Mm-hmm.
And and they look at his lunch and they're sort of surprised with his lunch. It's like things like hummus and pita bread, lots of fruit. His yogurts. So it's simple. It's clean, and not the cakes and the candies and the chocolates and things like that the other kids have, or the chips and the Cheetos. So I do believe when a parent makes a choice to not immunize a child, you're taking on a whole different responsibility. And that responsibility is to keep them as healthy as you can and as physically fit as you can. And it all goes together. Your 6 points, Glenn. Sleeping well. The things that you believe in, and
Right.
spiritually strong, and the belief system. Whereas when people have a cold, we don't want to give it to your child. I said, I don't believe he's going to get it. It's simple. I don't believe he's going to get it. He
Right.
wash his hands, wash his face. Essential oils. It's a number of things, and it's a lot more work, so to say. It's
Yes,
a lot more work when we're doing that. So it's a choice. It's a responsibility.
Yeah, it is. And there's a few other parts of that responsibility too, and you always have options. One of the things that I think is important to talk about is if you choose to have a child that's not vaccinated, it's very important to have that child, once they are capable of grasping it, to actually understand that they have not been vaccinated and how diseases get transmitted. So if they see another child coughing in the playground, it's important for them to know that that cough might be an infectious cough and that they have to be aware of that. And most parents, I'm not sure, actually have that discussion with their kids, the awareness of illnesses being transmitted and what we've chosen for you as a child, and therefore you are more susceptible in certain ways, so you have to do even more things than other kids might do.
Right.
Yeah, and then the other part of that is to make decisions depending on if you're a traveler and you're going to take your child or yourself to another country where there are other diseases that we're not quite used to, like, for example, malaria or typhoid fever, where you always have opportunities to consider talking with a travel consultant, like we did with Mary Louise Scully, when and deciding whether or not I'm going to be working. I've decided to go to India and bring my child because I know there's a measles epidemic right now, and we want to work in some clinics there helping all the children. And you're going to go there, so you always have the opportunity then to get vaccinated. So even if you didn't get vaccinated as a child, you still have an opportunity.
Which when it comes to that time that sort of travel or situation comes up, then yes, it is a whole that's a whole nother level of making a choice.
That's right.
Do we want to go to the jungles of Thailand? Yes. So we're all going to have the malaria shots or the pills or whatever that is.
Right. Exactly. It's important, I think. Anyway, it's just good to know that those are the options. So we're still inside the doctor's bag, and we're going to move away from viruses. Unless there is...
I feel like you should have a bag and you should be throwing things out of your bag.
I do have a bag. I take it on my house calls with me. Maybe I have to define house calls, since many people haven't heard of them in this generation.
Generation. Now you can Skype now.
But some of us still do make house calls.
Oh, that's great.
Anyway, part 2. I decided that, I see a lot of people that get injured and in many parts of a day, and some of them are minor injuries, but people don't always know what to do. So I decided to take a little time on this show and talk about what to do when you get hurt in an accident. And I'm only going to focus on moments to hours. So this isn't going to be how to go through a month with a pain or a year or something like that. This is in that moment where you just took a fall and you're lying on the ground. And what do you do? Well, the first thing that I always say is, again, we go back to preparatory medicine. Be in the best health you can be. Make sure you sleep well, your nutrition is good, your exercise is good. And exercise becomes important, especially with accidents and injuries, because if your bones and muscles and tendons and ligaments are in the best of condition, then you may not get hurt as badly. And if you do get hurt badly, you did go into it in the best of condition, but you also may heal better. So that's where I wanted to go today. And part of this is to turn everyone into an emergency medicine physician for the moment, either for your, either for yourself or for a family member or a friend, or you just happen to be on the street and see something going on. So the process here is you get hurt. You take a fall, you twist an ankle, you do something. The first purpose is to live. That's why we're here, and that's what we want to keep doing. So
that's a major accident.
Yes, and we know major accidents do happen. So, and we're going to talk about that for just a moment. The second purpose of what I'm trying to do right now is to be able to, after the accident, at some point, maybe not in that moment, but down the line, you want to be able to maintain function of an organ or a limb. You want to maintain good range of motion, and you want to maintain good strength. So this means that in the moment that one injures themselves or takes a fall or catches a hand in a door or cuts themselves, in that one moment, the moves that you make next could eventually affect your entire future of healing and recovery. And I think that's a key point for people to know. So when you do get hurt, it's really a good idea to understand that this moment is vital. Now, the first assumption is that you're not hurt critically with a life or a limb or sight-threatening injury. Otherwise, call 911. That's what they're there for. So that means if you're actually having difficulty breathing, or you're having chest pain, or you see severe bleeding, or there's an altered level of consciousness, 911 is the key. But we're moving more toward a simpler type of an accident. Like I said, a fall, a twisted ankle, an injured extremity or a joint, or some kind of a laceration, a cut, or an abrasion or something that. So that's where we're focusing on today. So the first thing to do is to make sure you're alive. Now that sounds kind of weird, but and obvious, but just take a moment to make sure that you are okay. The second thing to do is to get out of harm's way. In other words, if you tripped in the middle of a street or an intersection, if you can, get out of harm's way. If you fell on a railroad track, you want to get out of harm's way. If you're running in Spain for the running of the bulls and you twist your ankle, you want to get out of the way.
Climb!
Right. But other than that, if you're not in harm's way and you are alive, my suggestion is initially don't move. Do not move. And as I said before, because the next move you make could mean the difference between a good or a bad outcome. So initially don't move and begin to breathe and try and relax. Very important, and the reason that this is so important, and this is why we talk about the metaphor square breath and practicing all these things, is so that when you do have that moment, you try your best to breathe and relax if you can. Sometimes it can happen. Then, what we do in the emergency department when somebody comes in after an accident is we do a quick initial assessment. Sometimes we call it our primary survey. And this is to determine what area or areas are actually hurt or deformed or bleeding. So you want to do a quick survey of everything that you can see or feel if you can move. And basically, you don't want to do much about it. You just want to define all of the areas. Something may be obvious. You may see a deformity on a finger, if you fell and the finger is dislocated or broken. But don't stop at that point. Just acknowledge it and keep moving on. One of the things that was prevalent in the emergency department, especially when somebody would come in with multi-level accident with multiple body parts injured is they have such severe pain in one area that it actually can mask other injuries. So it's very important in your primary survey, your initial examination of yourself, is don't stop when you find something with pain. Mark it in your mind and say, okay, my left wrist hurts. Keep going. And you want to make sure there is or something else, or if there's not something else. Now, if in your survey you do see something that's deformed or actively bleeding, or you see a body part that is normally inside and now it's on the outside, and it's one that you've never seen before.
Hopefully, if it used to live on the inside, hopefully you've never seen it before.
Exactly. That's another time to call 911 or go directly to a hospital if you can. Otherwise, if after your initial assessment, you see that there's no bleeding, you might have a pain here and maybe a little bit of a deformity here, but it doesn't look too bad. The next thing to do, and this is strange, but it's called think about the mechanism of injury. It's very important to know that because that gives you clues as to the extent of a problem, the power of a problem, and also when you are going to talk with your doctor about it, that helps them to decide that there might be some other things going on. So in other words, if you catch your fingernail in a drawer as you're closing it, you pretty much know that's the mechanism of injury, that's all the problem is. But if you if somebody came into the emergency department where they were going 70 miles an hour, they were hit, and they went thrown out of the car through the windshield 60 to 80 feet, that mechanism of injury says to the doctor, there's a lot of forces and energies here that can cause lots of problems. So it makes you want to look for more things and go more deeply into something. The obvious idea would be, say, a stab wound. Somebody stabs you with a knife, but they only stab you, but it's a 1-year-old accidentally stabbing you, or a 3-year-old with not much strength. That mechanism of injury says that the knife might not have gone in very far, so we don't have to worry that it penetrated the intestines or a lung or a different part of the body. So the mechanism of injury is very important to think about, and just put it in the back of your mind. After your initial assessment and your mechanism of injury, then it's time to evaluate the extent of each injury. So going back to if there's only one area or multiple areas, you take your time and go through each area. And when you're measuring the extent of an injury, first question, obviously, and the one that drives us toward everything, is basically pain. Try and give a description to the pain for yourself or to someone else who's talking to you. Is it sharp? Is it dull? Is it burning? So figure out your own pain descriptions and give that, even to yourself. Then try and put it on a pain scale. How much is this hurting me right now on a scale? And usually you go 0 to 10, 0 being no pain, 10 being the worst pain you could ever imagine. And the reason that you do this is partly for the primary injury, but then we're going to talk about for the primary assessment, but we're going to talk later about a secondary assessment. But the first part is to determine how bad it really appears to be. And then you measure it over time, and if it's getting worse or better. So for example, if you start with a pain, your dislocated finger, and you say it's 8 out of 10, or it's not dislocated, but it's really hurting and you can't see anything wrong, but 5 minutes later it's only a 2 out of 10, then you know that it's not something really bad, and it gives you an idea that you're okay, and you can relax about it and make decisions based on that. On the other hand, if it started out as a 2 and now it's an 8, you know that this is something you have to deal with in a different way. And it gives you that opportunity to evaluate it over time. So try and figure out, after labeling the pain, how bad is it? once you label the pain and you've given it a scale, the next thing is to determine whether or not within that process you need professional help. If it gets worse or it's really bad, you need professional help. If it's not, then you can probably decide you're going to stay home and take care of it or so. Following this, after the pain, you want to see what makes the pain worse. So you look at a body part, and if looking at it makes it hurt more, then you probably need to go to the doctor. If looking at it doesn't make it hurt more, then the next thing to do is touch it with another part of your body. So if you have a finger that's hurt or a knee or an ankle, don't move that ankle yet. Try and touch it with your hand and feel it, and feel all around that ankle. And this brings up a very important point for people. I think it's important that everyone becomes less squeamish about your own body. You don't want to be saying, ooh, blood. You need to understand that's part of your body, that's part of your life, and you want to keep that blood in there, so it's good to learn about it. I suggest and recommend that everyone go out and buy some kind of an anatomy book, and this shows my age, or a DVD or an app or a website or something like that, where you can learn a little bit about anatomy, and also when and if you do get hurt and you have a joint that's hurt and you're figuring it out, you can go to this anatomy book or app and try and establish what really hurts. And is it a bone? Is it a tendon? Is it a muscle? Is it a ligament? And over time, the more that you learn this, and if you're preparatory and you start trying to learn these things before you get hurt, you'll do a lot better in life. So you're trying to determine what makes the pain worse. Do I need to take a moment here?
Yes.
Okay. Are you evaluating yourself right now?
That was cute. I like that.
What makes the pain worse? So the first part you want to see about movement. And when you're looking at movement, I would say first do it passively. So if you have a finger that is hurting or an ankle that's hurting, try and not move it by trying to move the finger, but try to move it with another finger. So that means you're not actually tightening up your own muscles or your ligaments and tendons. You're allowing them to rest as carefully as possible. And try and just palpate or touch around the area that might be hurting, and see if you get a sense, feeling something out of place or feeling something moving that shouldn't be moving. If you hear sounds that you've never heard before, like the sound of a bone crunching, then don't go to the next phase of trying to move it actively, which means using the body's own muscles to move it. If in your movement passively you find that you're able to move it through the range of motion, and you should know the range of motion of each of your joints. You know, you could look at a shoulder joint which has a different range of motion than a finger joint. So you should passively test the range of motion, and if that range of motion hurts, stop moving it and don't go past that. If that range of motion doesn't hurt and you have pretty good range of motion, which you seem to believe is the same you had before the accident, then you go to active range of motion, and that's where you actually move the body part on its own. If it doesn't hurt with that type of movement, then you're okay. If it does hurt with that type of movement, be aware of it, move on to the next place, or you may need to immobilize it so that it doesn't move anymore. Because again, remember I said from the beginning, in that one first moment, if you have something that's being held on by just one little shred of a ligament, you want to keep that intact. And if you have a bone that's about to pinch a spinal nerve, which is going to paralyze you for the rest of your life, it's best not to do those movements until you've defined that you can move. Mm-hmm. After you figure out what makes the pain worse, then try and figure out what makes the pain go away. So if you find that a joint is comfortable in this position but not in that position, that's the position you should go for, and try and keep it in that position. You should also look for any other sensations or lack of sensations, numbness or tingling, loss of strength or sensation. Should I stop for a moment and let you ask me a question, or should I just keep blasting through this whole thing?
No, I think because we're coming up to our hour already. So keep blasting, and then at the end of all this, so we can always come back.
Okay, I'm going to keep blasting then. So we talked about what makes the pain go away and sensations or lack of sensation. Then certainly look at the integrity of the skin. Has it been compromised? Is there a cut, a laceration, a puncture, an abrasion, a burn, a bite, or a sting? Any of these things, and take care of them appropriately. Obviously, a laceration and bleeding, you have to take care of differently. So you do this whole thing in each of the areas, and you've identified in the primary survey. And then I say, after you've done all that and you've gone through all this, do a secondary survey. Go through everything again. See if anything that was hurting at the beginning is now better, so you don't have to focus on it. And if in your original survey there's now something hurting that you didn't find, then mark that and go through the whole process of the pain and everything else, evaluation with the movements, etc., in your secondary survey. So a primary survey and a secondary survey. If in your evaluation, then is the time, if you're on the ground, that's the time to get up once you've assumed you can get up. And then try and determine whether you can get up with help or without. Get to a more comfortable position and start doing first aid, cleaning wounds, stabilizing joints, etc. And then you make the next determination, which is something that can be, is this something that can be watched? Is it something that needs to be discussed with your family doctor, or you need to actually go to an emergency department once you've done that secondary survey? And I would say make sure that if you do have an injury where there's laceration or the skin has been compromised, certainly consider to make sure your tetanus immunization is up to date, especially for dirty wounds. And the last few things I'll say, I always use ice first for swelling, and I use it for about 10 minutes at a time. Can do it a number of times every few hours. Don't put it directly on the skin. If you have a back, a pelvis, or a lower extremity injury and involved, and it's painful to bear weight and walk, then if you don't want to be seen by a doctor and get it truly evaluated, then you might want to use something to help with weight bearing, and that would be crutches or a cane. And certainly if you use crutches, make sure you use them appropriately with the right size and measurements so they're not up in your axilla or armpit. And if you use the cane, the standard approach is to use the cane in the opposite hand of whatever extremity you injured. So if you injured a left hip or left knee or left ankle, use the cane in your right hand. Discuss that with your physical therapist if you need to. You don't want to cause problems that by avoiding pain, you throw your whole body out of alignment, and this could be a worse problem over time. The other thing that I talk about is I do not recommend anti-inflammatory medication at first for anyone. The inflammatory process is a normal physiological part of healing, and it's a necessary part that allows the body to begin to heal. If you prevent the body from doing its normal things, then you may prevent the whole healing process. And usually in an accident, acute accident within moments, there's no inflammation at the site, so there's no need to use an anti-inflammatory. So remember, basically after you do your surveys, the decisions that you make at that time may have long-term consequences. So the final thing I would say is after you've done your evaluations and you've done all the things you want to do, and you're trying to decide, do I go to the doctor? Do I stay home and watch it? Do I go to a hospital? Consider for a moment the possibility of the long-term effects. And that may help you in your process of making the decision. So with that, I think I'm going to close the doctor's bag unless you have a question or two.
That was a whooping wealth of information. I think we need a show just on that.
It's pretty important. And I think, a lot of times when I'm preparing for a show, I talk to people that I know that are actually in healthcare, and I talk to them and I say, so what will you do during an acute injury? And most of the time they'll say something like, well, that's your job. I just want to deal with it after, a longer period of time. So I want to deal with it after the doctor dealt with it, and I'm a physical therapist, so I'm going to help you heal. The important part of an injury is to think immediately about healing and as I said, to regain strength, range of motion, sensations, everything else. So the things that one does in that very first moment, and that's why I think this was important, can determine those factors.
Okay. Close that doctor's bag.
Closing the bag.
Yes, I mean, moments of that were quite graphic, of course, as you visualize it in your mind, and it's very powerful. And I think it is really important, Glenn, because I know people who have fallen and waited for days before actually going to see a doctor, and next thing you know, it's actually more severe than they know it is, than they believed it was. And of course, as you say, the anti-inflammatories. Oh, let's just pop a few of those, just put a few, of those down and I feel better.
Right.
So I don't need to go see the doctor.
Exactly.
Well, So I think you gave some very, very good advice. And I do believe that should be a show on its own. The simple first aid and then the more critical first aid.
Yeah. This is self-evaluation. We haven't even gotten to first aid yet. Almost.
Oh, okay.
This is just part of it. I think, some of the take-home messages, we did talk about the measles and things like that, but in the take-home messages for the second part is learn to know, understand, and respect your body. And that's important. So if you know how it normally functions, that's your goal for if you get into an accident. You want to get it back to that point. And all of the decision-making that comes after that very first moment can affect everything. And you see people all the time. You see a person who has a deformed finger or deformed elbow, or they walk with a limp, or something is wrong, and it's because they got into an accident or injury and handled it not necessarily appropriately at first. Certainly things do happen. Bad accidents, may never get back to normal, but it's always our hope. Like I said, we want to remain alive and we want to remain functional.
Yeah, absolutely. Absolutely. Well, thank you, Dr. Glenn Woolman, for this wonderful moment in our magical tour.
Yes, definitely.
Now, but I want to know, of course, if you have a tip.
I think my tip for today goes on to part 2. And that is, and I said it already as we were talking, get an anatomy book, get an anatomy app, get an anatomy something, and start learning it on your own, teaching everyone in your family, teaching your children. The more that you learn anatomy to the degree that you need to, the better off you will be. So that's my health tip. And you never know. I think the thing that happened to me is I started appreciating anatomy when I was very young, and that made me go into medicine because I loved the body so much and what it did and what it was about. So there's always a possibility that aside from just learning about the bones and joints and internal organs in your body, if you're showing it to your kids, you may stimulate one of your children to go into medicine or some form of healing. That's my health tip.
Oh, I agree with all of that.
Okay, what health tip have you not agreed with yet?
None.
Okay.
So far, so
So
far,
far, yeah,
so
there could
far.
be one coming.
There could be one. You never
Yeah,
know.
that's right. I may not agree with somebody's upcoming health tip.
Absolutely, but not yet. Not yet.
Not
I
yet.
think it's been really, really wonderful, and sometimes a surprise. And there's that's why the end of the year or beginning of the year compilation of all the health tips are so wonderful to have.
Yeah, Segovia does a great job on that. It's so much fun to listen to all of them. It brings back the memories of all the other things that people talked about, but then
Right.
giving the insights. Part of what we talk about are the heart and soul of the healers
Hmm.
on this show. And I think one of the things that the health tip usually surprises me about or comes out about is it's more from their heart and soul. It's not necessarily from what their specialty is or what they do. It's a heart and soul process. And I really love that.
Mm. As the Yoga Hub team.
Yes, definitely. So I'd like to thank myself as our special guest. I'd like to thank Christina for her willingness to be on the show today from another part of the world, the northern part of North America. And for Segovia and everyone else. And I want to thank all of my healers and teachers for helping me on my journey. And until next week, when we travel through another quadrant of the healthcare galaxy, I want to thank you, Christina and Segovia, and all of YogaHub and all of our listeners and viewers. And I wish you all optimal health.
Thank you, Dr. Woolman, for another great moment in that doctor's bag. And of course, Segovia Smith and the Yoga Hub team for being able to tap me in to this show. And of course, to each and every one of you for joining us in this new platform of education and information. We're always grateful for your continuous support, and we look forward to hearing your feedback on how we can serve you better. You can connect with Dr. Glenn Woolman through his website at glennwoolman.com, glennwoolman.com, and be sure to learn about his metaphor square breath, exactly what he was talking about during the show, to keep yourself calm and to help you through those times that, a wave might have hit. And of course, we would love to hear your feedback, comments, suggestions. You can either scroll down on your screen and type it into the comment box, or if you're listening to this as a podcast, please give us a call at 818-LETS-TALK, 818-LETS-TALK, and be sure to leave your contact information. And until next time, maybe I'll be back in the US as long as there's no measles up here. That's going to ward us from coming back. We will speak to you again and look forward to having you on our show. Namaste. This live event coverage is brought to you by YogaHub.com. Make YogaHub your new media channel for health and wellness, with original programming and shows ranging from yoga and meditation to parenting and nutrition. We have hundreds of videos with experts, authors, and medical professionals. Visit us online at YogaHub.com or search for YHTV on iTunes and subscribe today.